Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gwen Vaughn.
And once again, it's time for the Auburn Medical Group live stream because it's a Monday at 4:30 Pacific. And you probably got notifications if you've hit the little bell icon. So this is myself, Dr. Mark Vaughn, no Dr. Gwen Vaughn, who would normally be right here by my side because he's on vacation. So we get to talk about anticholinergic poisoning without him, and it'll be great. We already have a comment from Lindsay Antoine. Let's see if I can get the chat going there, asking about if Benadryl will be a part of the discussion. Unfortunately, she's experienced an overdose of Benadryl, which can happen. And Benadryl is a big part of what we'll be talking about today. Another big part of what we're talking about is the current heat we have. Right here in Northern California, we're having terrible heat. You might even be able to have the air conditioner going over the mic because it's just been going all day. It's so hot right now, and we'll continue to have hot days throughout the coming months. And anticholinergic medications that we're going to be talking about are a part of that discussion about heat. So let me get to that in a moment. First, we're going to look at who else is out there in chat world. We've got Robert Antonio saying hello. And of course, we're going to have many more people as the show goes on with their comments and questions. If you're watching this after the fact because you're interested in the subject, please subscribe to the channel so you can learn about other similar topics and be a part of the discussion by getting notifications, if you enable notifications, so that when we go live, you can also participate. Okay, we also have Friend and Family's Dog Grooming has an account on YouTube. How does ibuprofen to you? And so we can talk about ibuprofen, although it's not in this class of medicine we're talking about. And then EVNZ, hello from New Zealand. Well, hello. It's so cool that we get people from other parts of the world, even all the way across the Pacific. So thank you for being a part of this. I would guess it's terribly late for you. Maybe not too terrible. Maybe a really extended late bedtime would be appropriate, or would be thinkable anyway. So let's get into this. I have a little outline in the description, and I'm going to jump to that so that you can see it on screen here without having to go down to that, and so that we can look at it together. So I'll switch to the browser here in a moment. Oh, 11:33 a.m. See, it is. Wait, a.m.? Oh, because it's tomorrow. It's that far ahead in New Zealand. Wow. Oh, also we have Catherine saying, my ears constantly itch, not inside the canal, just the inside of the ear. What can I use to stop the itch? Well, I can't practice medicine over YouTube, according to the California State Board. When somebody has a problem similar to that, though, we will often just use an over-the-counter and cortisone cream. But that would be something for you to talk to your doctor about. Anti-itch cream. Okay, let's jump into the browser. So let me pull it up, and you can watch along. You can follow along. So this is our little outline for what we're talking about with anticholinergic syndrome, and you should be able to see that I've got a little cursor there showing where I'm reading currently. I'm reading about the chemistry and what we're talking about with these anticholinergics. First, you need a little background. There's these things called neurotransmitters. These are molecules that pass messages from one nerve cell to another nerve cell in the brain and throughout the body, the entire nervous system. And there's one of them called acetylcholine, and this is a major one. It's involved in a lot of just basic life functions, keeping the body functioning. And the anticholinergic drugs block the receptors on nerves for specifically the acetylcholine. And so this prevents the normal so-called cholinergic I messed something up, didn't I? The normal cholinergic activity. See, Control Z fixes everything. You ever wish that you had Control Z for something else in your life outside of a computer? Wish you could, Control Z. Yeah, we don't have that. Oh, today, a little bit on the healthier side, getting a green tea with real strawberries. I don't know if you can see, but there's real strawberries there. If I held up the camera, it won't be as in focus, but you'll be able to see there's things sinking to the bottom. I was going to say floating around, but they're sinking to the bottom. So a little bit on the healthier side today. Oh, I don't have Dr. Gwaine talking, so I can take a sip of my drink during the show. We'll get back to it. So what are the symptoms of this anticholinergic syndrome when you have an interruption of the normal transmission of acetylcholine from one nerve cell to another? Well, it causes some problems. You get, oh, and look, we got a cute little way of putting it so you can remember it. Red as, you know what, I can make this all bigger for the people watching at home by just, hitting this. There you go. Yeah. Now maybe it's a little more readable over your computer or wherever you're watching this. So the symptoms here are red as a beet, hot as a hare, blind as a bat, dry as a bone, mad as a hatter. What's that mean? And full as a flask. So yeah, they're interesting things. So the red as a beet is because it causes dilation of blood cells in the skin. So people actually turn red. You'll see them red when they have this. Hot as a hare is because of all the blood in the skin. You feel hot when the blood is going to the skin. Blind as a bat, there's dilation of the pupils, and with that, a relaxation also of the ciliary muscles that stretch the lens to focus, and so people will be have blurred vision. Dry as a bone. Well, that's because of the stopping of the production of saliva and other secretions. And so you think about just no liquid coming out. Eyes, mouth, urine, diarrhea. The reason I say that is because it's liquid, so because there's constipation with it. So nothing coming out. No sweat, which is dangerous in the heat. So this has a role in temperature regulation, and it impairs temperature regulation is what it does, temperature regulation, especially in older people who are very vulnerable to this because they already have a little bit of a problem with that, with just that occurs with age, with temperature regulation. And then you throw anticholinergic drugs on top of it in a day like today, and you've got a recipe for heat stroke. So blind that's because of loss of being able to focus. Dry as a bone, that's because no release of liquids, no secretions coming out. Mad as a hatter, it causes mental status change. These people they'll seem very weird. Like I'll give you two examples. One was a gentleman who took an extra pill for his restless legs the night before. And he had all these symptoms, and driving to the office, he had to stop and have his wife drive, and he was saying crazy things like, please unplug me and plug me back in. He wanted to be reset like you would do to some kind of electronic item that wasn't functioning, hoping it works when you plug it back in. He was asking her to do that to him, and then he was taking his glasses off because he thought they were his wife's because he was having the blurred vision with it. So that's the mad as a hatter. Another patient more recently, within the last 2-3 weeks, older lady had too much anticholinergic medicine, and I don't remember why it happened to her, whether they took some over-the-counter medicine or just had too many medicines that have anticholinergic activity at once. But she was just excessively talking and interrupting her daughter and us as we were trying to help her, and was also disturbed by it. Something wasn't right, and she didn't. And that's the way the earlier patient who had the medicine for restless legs, feeling like there's something not right and wanting it fixed and anxious about it, kind of antsy, and it just we'll get to how we fix it, but to give you a little spoiler, it takes time. Okay, mad as a hatter, and then I had said full as a flask. That's also relating to the urinary retention. They are full of the liquids that aren't getting out. So the dry as a bone and full as a flask go together. Nothing's coming out of the flask. It's full, nothing's coming out. So they can actually be very uncomfortable from having to urinate, but not able to, because the muscles won't relax. The nerves can't tell the muscles to relax because the message is being blocked by the anticholinergic medicine. So the acetylcholine doesn't get to the receptor. All right, let's get back to some questions here since we finished a section. Let's see. Back to the chat. and then I'll see which chat we're going to let through. Actually, you can see all of them if you're looking on YouTube there. Okay, chat. Catherine, she apparently following up on the hydrocortisone for ears. That doesn't help. And then since we don't have any comments on the chat immediately right here, right now, we'll go ahead and jump back into what drugs cause this. So here's the list of the drugs. And what you'll notice is, let me bring up the cursor. 1, 2, 3, 4, 5, 6, 7. The first 7 classes of drugs I listed, the first 7 that I listed start with the word anti. Antihistamine, antidepressant, antitussive, cough medicine, antipsychotics, anticonvulsants, that would be for epilepsy, antiemetics, that's to stop vomiting or treat nausea, antihypertensives, all of these anti-drugs. So if you have a drug in a class that's an anti, chances are it has anticholinergic activity. I'll show you how to find out in just a moment. But in addition to all those classes of medicines, muscle relaxants, many of the opiates, even eye drops that people put in their eyes to treat conditions can cause these systemic anticholinergic effects. So eye drops should not be dismissed or ruled out when somebody's having some of these symptoms as a possible cause. And of course, you want to talk to your doctor if you're suspecting that somebody has these symptoms. So we're going to go to how you find out if you have them. I love this website. It's called ACB Calculator, and it's at acbcalc.com. And so you just put in a drug here. Okay, let's put in the name of an antihypertensive, atenolol. And look, it comes up. The atenolol is on the list, and it gets a score of 1. Well, if you look down here, you probably can't see this, but on a computer, you could look for yourself and find that drugs with possible anticholinergic burden score a 1, drugs with definite anticholinergic burden score 2 or 3, and if you, let's put in a score of 3 here. Let's put some, what's a really bad one? Flexeril is a bad one. It gets a score of 2. Look, I just made the total score 3 with a person with a medicine for their blood pressure and a muscle relaxant. Together, the score 3, and it says right here, your patient has a score of greater than or equal to 3 and is therefore at higher risk of confusion, falls, and death. Death even is something that we're concerned about with overdoses of anticholinergic drugs. Quite often, it's due to some kind of problem secondary to this, like their vision is off, and so they trip and fall and hit their head. Well, the cause of death would be the blow to the head, but this would be a secondary cause, one step removed from it. So they can be very dangerous. They can also cause seizures, even though it's anti-seizure medicines that contribute to it. Kind of a oxymoron there. But the classes are very, very common medicines. Let's put in another one. Let's put in just a common antidepressant that's used, amitriptyline, that gets a score of 3, or as Lindsay Antwine was talking about earlier, Benadryl, a score of 3, one drug by itself, and we consider the person at risk for something bad happening. So if you have just a couple of drugs that get a score of 1, say the person has benazepril and atenolol, 2 different blood pressure medicines, well, then the score is only 2. So you can see how a combination of medicines totally depends on the anticholinergic burden of that medicine and also the dose. And this does not take into account the dose. The higher dose, of course, is going to be more anticholinergic activity than a lower dose of the medicine. And we really don't have an easy way to calculate the risk. This is kind of the best thing that's out there. And it's not giving you a super accurate measure because you may have a really high dose of something that's just a 1 and a really low dose of something that's a 2. So I want to hit on the Benadryl again, like Lindsay Antwine was talking about here. Let's see if we have anything more on the chat just right now. No. The Benadryl is very common, and I had a patient just last week who was on some anticholinergic medicine, having some symptoms that could have been attributed to it, like confusion, and we were getting the medicines off. And then I found out, well, actually, they had a visit to the hospital. And just so you know, we're not the ones prescribing all these anticholinergic. We do prescribe some anticholinergic medicines, but specialists oftentimes will throw these drugs on and not be thinking, oh, this patient is older and much more vulnerable. And they may not even be aware of the anticholinergic activity of the drugs they're prescribing, just because it's hard to keep track of all that unless you're really, really on it or have a reason to suspect it, like the patient comes in confused. So anyway, the patient was given, I guess because they're having trouble sleeping, 50 milligrams of Benadryl, twice the normal dose. And they were already having trouble. And Benadryl, you remember, is a score of 3 all by itself. So putting the patient at great risk. And we were able to call and say, hey, don't do that anymore. As far as I know, they were okay from that episode of getting the 50 milligrams of Benadryl at night. But if that happened on a night when it's really hot and they're not able to cool off, say a family doesn't have air conditioning, that could be a problem. They could have an inability to cool their body with the stopping of the perspiration. And that's why this is such a timely topic for right now. Okay, we have a comment here from Monica Edfest. Hello from Sweden. Oh, and she's also doing the seedling little emoji there. And Robert Antonio says, is there a particular chemical compound in the drugs responsible for the anticholinergic activity? And the answer is yes. It is a shape that looks like acetylcholine, but isn't exactly, because then it'd be acetylcholine. So its shape is very similar to the point that it can block the receptors. And it's not necessarily the same thing. It's just a part of the entire molecule is similar enough. And so when you say, is there a particular chemical compound? Yes, the drug itself is the chemical. It's one chemical. It's not a combination of chemicals. And a part of the chemical looks enough like, or is shaped enough like, three-dimensionally, like acetylcholine to block the receptor. So, good question. And then getting back to some other common medicines that cause this, there's so many of them. If you start putting in a letter, you'll see all of the different medicines that come up under that letter. I don't know how well you can see this. Bentyl, another muscle relaxant, we'll put in C. We see carbamazepine, which is an anti-seizure drug. And actually, it's the only anti-seizure drug I know of that has this problem. So it's not as bad as a class as some of the other classes. Put in D, Demerol, there's an opioid, I guess I should say. Depakote, that's another seizure medicine, so there is more than one. E, Effexor, Elavil, Enablix, E, citalopram. Now, I'll put in escitalopram because I wanted to show that it's only a score of 1 compared to the older antidepressants, like the tricyclics, that get a score of 3. The newer ones, like escitalopram, only get a score of 1. So if you're going to be using something to treat, especially in older, that's what we're talking about. This is especially as people get older than 65. If you're going to treat them with an antidepressant, you want to go with something like escitalopram to decrease the anticholinergic burden compared to something like amitriptyline that's much more concerning. Making a quick little visit to the comments. Oh, okay, now that's interesting. We got some greetings from Australia by Michael Andrew. Thank you, Michael Andrew from Australia. We know that it's early tomorrow morning in Australia. Tomorrow here in the United States is going to be the 4th of July, Independence Day. It's a big deal. We celebrate it. I was going to say we celebrate with fireworks, but fire danger is so high around here. We have one public display and no other fireworks around, which is okay. I see that the drone displays they're having are quite interesting, and that's pretty cool too. Okay, and then Lindsay Antoine, venlafaxine is anticholinergic? Question mark. Let's find out. You can play this game at home. So to play along at home, you can see all my comments over there, can't you? You just put that venlafaxine in there, and look, it does have anticholinergic activity. It gets a score of 1. So Effexor, or venlafaxine, the generic name, is an antidepressant that's similar to the escitalopram or the serotonin selective reuptake inhibitors, SSRI. It's called an NSRI, norepinephrine and serotonin reuptake inhibitor. And those also are neurotransmitters, just like the acetylcholine we're talking about with the anticholinergic drugs. All right, so you've seen the ACB calculator, and you've seen the drugs that we're talking about. You've seen the symptoms, and it's mainly in people who have a hard time processing their medications, or their body symptoms, like, for example, for cooling, are already a little compromised, usually by age. All right, one more check of your wonderful comments. You said Effexor. Yes, I did say Effexor, because venlafaxine is the generic name for Effexor. So I hope that this was helpful. I hope that you can use the ACB calculator on your own drug list if you take medicines and see what your score is. If it's 3 or higher, you're going to want to make a change. See if you can cut that down and get it lower. Especially if you have a family member, or maybe you yourself are over 65 and have concern about these interactions. You can talk to your doctor about it. If you've been on them for a while and haven't had a problem, and you're not in the middle of a heat wave, it's not an emergency, but it should be addressed. So I want to especially thank Lindsay Antwine for what she does to make this show possible. Let you know you can too by somewhere over, where is it? Over here. At the end of the show, you'll see the list of names, and there'll be a little link there, or at least an address you can go to if you want to be a part of Patreon. Help support, contribute to the delinquency of a doctor. Although today it's real strawberries, so probably less than a third of the calories of what I usually order there. Until next time, it's just Dr. Vaughn, not the other Dr. Vaughn, telling you to stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.